This PowerPoint will very briefly introduce 3 case studies of interventions to be evaluated, which will be used as examples in some of the teaching topics and which you can use to fill out your pro forma if you don't already have your own project in mind. The first case study is community-based NHS health checks. The NHS Health Check is a national programme to offer eligible adults aged 40 to 74 years a risk assessment for heart disease, stroke, type 2 diabetes and chronic kidney disease. And this is followed by a risk communication consultation and signposting and referral or support for making lifestyle changes to reduce identified risk to vascular health. Due to a low uptake of health checks through the GPs, which is the usual point of access, and specifically amongst some population groups and geographic locations, a community service was commissioned. The chosen provider was required to identify and secure a range of community venues such as community halls, places of religious worship and health centres for delivery of the NHS health checks at different times of the day and evening, on weekends and during the weekdays. The overarching aim of the programme is to reduce inequality in access and uptake of health checks, to improve the early identification of adults aged 40 to 74 years with the highest risk of cardiovascular disease with previously undetected vascular conditions. The second case study is a new model of direct optometrist referral of cataract patients to ophthalmology outpatients. At present in the NHS, patients assessed by an optometrist as having a cataract needing treatment are referred to a general practitioner, who then refers the patient to the ophthalmology outpatients. The main criticism of this process is that it usually involves unnecessary GP involvement and adds to patient waiting time, as the vast majority of patients are referred on by their GP to secondary care in ophthalmology outpatients. Action on Cataracts, a modernisation initiative based on good practice, was recently introduced to the health service for your region. It aimed to redesign cataract services to improve access, make the patient pathway more efficient, and to increase numbers of operations. One of its recommendations was to streamline the cataract patient pathways of diagnosis and treatment, for example by introducing direct optometrist referral to outpatients and reducing the number of patient consultations. In the new pathway, an optometrist would refer the patient directly to ophthalmology outpatients with a copy of the referral to the GP. The GP would then be aware of the referral and could add any relevant medical information to inform the hospital. There's been a specifically commissioned programme to undertake an evaluation of the new regional direct referral service, which was introduced within the last year, with a view of adopting this model across a wider region to nearby districts, depending on the results. The aims of the intervention to be evaluated are to increase the proportion of appropriate needs-based referrals made to secondary care for cataract treatment, to reduce the number of steps in the clinical pathway for patients with cataracts, and this should produce a referral process that's swifter and more cost-effective, and also to decrease the time spent by GPs on referral of patients for treatment of cataracts. And lastly, to improve patient satisfaction. The final case study is sexual health provision in a local authority. The sexual health service intervention commissioned by Public Health involves a combination of an online service and STI workshop training for primary care staff. The online service aims to reach those at risk who do not normally access sexual health services, offering advice and information. It provides delivery of self-sampling kits for STIs to use at homes, provides laboratory testing, processing of the samples, reports results and management, and referral into treatment services where needed. The interactive workshops provide training to primary care staff on sexual health. They focus on enhancing practical skills and advice tailored to the local setting. The local authority would like to design an evaluation to assess the effectiveness of their current sexual health services after its implementation as part of an ongoing local review of public health services. Some of the aims of the intervention to be evaluated are to provide sexual health promotion, information and advice which aims to contribute to reducing the stigma associated with STIs and HIV, to offer rapid and easy access to services for the detection and management of asymptomatic sexually transmitted infections, to reduce prevalence and transmission, and treatment and partner notification will be carried out by local partner clinics. to address and meet the sexual healthcare needs of vulnerable people and those at risk of not accessing services, to reduce late diagnoses of HIV, and lastly to provide education to GPs and nurses on sexual health risk assessment, to overcome barriers in discussing sexual health in patients, and training in STI and HIV testing.